What is the types of dental implant? Dental implants have become a revolutionary solution for those seeking to restore their smile and oral functionality. Understanding the different types of dental implants available can help you make an informed decision about your dental health. 1. Endosteel implants. As the most common type of dental implant, endosteel implants are surgically placed directly into the jawbone. They typically consist of titanium and resemble small screws that act as artificial roots for the replacement teeth. Ideal for patients with sufficient bone height, these implants offer a sturdy foundation for single crowns, bridges, or even full dentures. 2. Subperiosteal implants. For patients who may not have enough healthy jawbone to support endosteel implants, subperiosteal implants provide a viable alternative. Instead of being placed into the jawbone, these implants rest on top of it, but beneath the gum tissue. A metal framework supports artificial teeth and is often used when bone augmentation procedures are not feasible. 3. Zygomatic implants. Zygomatic implants are less common but offer an innovative solution for individuals with significant bone loss in the upper jaw. These longer implants anchor into the cheekbone rather than the maxillary bone, providing stability without requiring extensive grafting procedures. 4. All-on-4 dental implants. Expressions such as all-on-4, all-on-6, etc. are used to express the technical methods of dental implants applied by the physician with professionalism. This advanced technique allows patients to receive a full set of new teeth using only 4 strategically placed endosteel implants per arch, upper or lower. The all-on-4 method is particularly beneficial for those needing complete restoration while minimizing recovery time and avoiding multiple surgeries.